Yes. Hi, good afternoon, and welcome to another session of Talk Pro Health. I'm Dr. Srividya, a physician by profession, and I'm the medical director for Apollo Pro Health. We take these webinars to create awareness about various forms of NCDs, the regular non communicable diseases, as in when the time comes, which is diabetes, hypertension, or dyslipidemia, coronary artery disease. But some of the time we pick up topics which are very, very common but less spoken of, like mental health, illness, and sleep. Today, we are picking up something which is what comes first in our mind when we talk about any type of addiction, and that is smoking. On the day or on the month where we are celebrating International Lung Day, we are talking about a habit which is one of the toughest to give up. And with me on this discussion, I welcome Dr. Bhargav, who is a senior consultant psychiatrist at Apollo Hospitals, Chennai, and Dr. Professor Jayalakshmi TK, who is a senior consultant pulmonologist at Apollo Specialty Hospital, Navi Mumbai. Welcome, doctors. So, to start with, I am just going to share a just a present, a click, a what is exactly when we talk about. Yeah. Yeah. Can we see? Yeah. So the idea here is that, sorry. So the idea here is that this is something which is very easily seen, and we can do a Google search on it. And what exactly does a cigarette contain? It contains not only nicotine, that is what anybody wants, but there is a very acidic medium in the form of acetic acid. There is methane, which is equivalent to sewer gas. There is arsenic, which is a poison. There's carbon monoxide, which is again inhalant. You have methanol. You have paint as one of the preservatives, as one of the packing substance, actually. And then ammonia, which is a very well-known toilet cleaner. We have nicotine, which is actually a insecticide. We have toluene, which is an industrial solvent. We have hexamine, which is a barbecue lighter. We have candle wax, and we have cadmium, which comes in our batteries. In each of these, when we see in market, it itself comes with a label saying, this is dangerous. Please do not bring it near your children and pets and all. And we are adapting to a lot of natural things. Like if you want to have a toilet cleaner, you're going for citronella, or for a floor wash, a citronella. For your agarbattis in the house, you want a natural thing. Even for sleep, you're looking at natural extract, but you're not looking that all these things are there, packed in a very small, less than 1 gram weighing cigarette. Even the paper is very low grade. And we are going to discuss how each of these affect our lung and our system in different way. To start with, let us talk about something which is so common to us. And yeah, so it's something which is very, very, very common to us. Professor Jayalakshmi, lung, we all know, it comes with a blatant warning saying it affects your lung, it affects your, system and all. But let us spell it out for our viewers. What exactly does cigarette smoking does to our lungs?
So, thank you for the introduction, and thank you for the detailed description of what all was there in the cigarette in the first place. So, as you can see, these toxic chemicals, when we are actually inhaling them directly, that leads to the effects on two parts. One, it has its effect on the lining of the throat, the lining of the lung, the bronchial tubes. So basically the lung, if you say, it consists of two parts. One is the bronchi, or the tubes which take the air into the lung, and one is the lung tissue itself. So the cigarette smoke has its effect on both. It has its immediate effect on the lining. That is, it starts right from the throat lining, the bronchial epithelium. It reduces the cilia. There are small fibrils called cilia within the bronchial tubes. So these help to actually expel out all the toxins which we are inhaling. And also there are cells which produce immunity. There are cells which improve the immunity of our system by preventing the toxins from entering, by preventing the microbiomes or the toxic infections from attacking us. Both the immunity as well as the function of the cilia gets affected by the cigarette smoke. Also, it makes the lining of these bronchi very inflamed so that there is more mucus production. So there is more mucus production, there is some narrowing of the bronchi. So this all leads to feeling of breathlessness, as well as the increased mucus production leads to increased chances of infection and a feeling of not well-being, because there is cough associated and there is an accumulation of cough, there is no able to breathe properly. So this is when it affects the bronchial tubes. Now it also can affect the substance of the lung. These are called as the alveoli or the air sacs. By affecting the substance of the lung, it produces a condition called as emphysema, where the alveoli, which are actually supposed to take in the oxygen, are not able to do their function because the alveolar walls get destroyed. This causes a condition called emphysema. The effect on the bronchi is what is called as a bronchitis. Thus, it affects the cilia, it affects the immunity, it affects the basic integrity of the lung structure itself, thus inhibiting our efficiency in breathing and in inhaling oxygen and in taking out the carbon dioxide, which is the main function of the lung.
So, I mean, we here are, I mean, very, very clearly, Dr. Jayalakshmi has spelled out what it does to a lung. So, to simplify it even more, it not only affects your lung, it starts affecting right from the place where we are breathing, that is our nose and our oral cavity. It starts affecting the mucosa, which if you look at or you feel it, it is the small softer part of our body, and it makes it stiffer, and it is going to restrict and damage the very system which is set out to protect. I'll come back to this in a little detail, to Jayalakshmi, but Bhargav, over to you. Tell me something. Why, when we know that smoking is not good for us, still we have annually at least 1.5 lakh people who start smoking new? And this is a new data. This is a known data. At least 1.5 lakh people of new smokers every year, annually.
First of all, thanks for the nice intro and launching a bit in a very valid topic, madam. Now, so as you rightly mentioned, so we all know this idea is so bad, so it does so much of things. The worry is like new people prop up every year, like some batch of new smokers join into the community. So very importantly, in psychiatry, what we say is smoking it's not just a physical dependence. Actually, it is a very conditioned psychological behavior.
Correct.
So, uh, and this behavior is reinforced by multiple factors. We're all social beings, right? Socially, it gets reinforced. Sometimes emotionally, it gets reinforced. Sometimes, biologically, it gets reinforced. So, when you speak about smoking, that is when it's very difficult to stop them, right? To get into smoking or to come out of smoking sometimes. Not being pessimistic though, but still. So you have to break all these three layers.
So I have friends, Bhargav, who I think have stopped speaking to me because I reinforce this every time. I mean, it is as close as that. But the point is here that, like, when we tell a smoker that it is injurious to health, but they are not able to understand because probably whatever Dr. Jayalakshmi illustrated is not happening as fast, or it's not like one immediate. But what is that biological need which people want to have a smoke every day?
Right. See, madam, I particularly, it's my opinion, so I'm not giving any textbook knowledge here, but I'll see. See, you see the lives have been becoming more technically, I would say, fast and, stressed out. Yeah, definitely that is a fact which we have to. We are dealing with it or not dealing with it. How are we dealing with it is a different question. But now, when we see this pattern of changes on a day-to-day basis, I'm not
Mm.
speaking about any. So all we require is some instant relief. We are looking for
Ah,
consciously or unconsciously. Now, there is the hack. So this smoking or caffeine, the moment you inhale your smoke, 10-20 seconds, it just gush
it's
into
the
your
rush.
brain, that the reward circuit, what we say. There, the dopamine
Mm.
surge comes. So now brain learns, oh, fine, I felt good. Please do that again. I felt good. Please do that again. So this is how the neuro, in doctors' terms, I would say biology, medical terms, neuroadaptation takes place. Okay, fine. I've learned this and now just give me. So naturally, this is one way it happens. Now, second thing, very importantly, we say this. The new batch, madam, you said conditioning is a culprit there.
Mm.
See, only if you take nicotine, you get into cravings and dependence. And now it's not like I go out. I'm working in an IT company. I go out, right? Yeah. Now I'll pair this smoking with the break. All right. So naturally, tomorrow, when this pairing happens repeatedly, even if that is where the craving sets in. Once there is a break, naturally you crave for something because there was a reward. So this conditioning might again be the second reason why most of the people, they condition their behavior of smoking with something, some neutral stimulus, which eventually gains this power to just start the craving. So I think probably these are the two things which I can relate from my side why this is happening
There's a
despite.
need for that. Okay.
And by
Very.
default, all the human beings, we by default we go for instant gratification. That minds the paleo mind works somewhere there, right?
I mean, it is actually very confounding to hear something like that, that our mental dependency is on short-term goals.
Huh?
But Dr. Jailakshmi, when we talk about smoking creating, I know people only talk about smoking causing cancer, or the cardiovascular disease. But there is something beyond cancer and cardiovascular disease where the smoking affects. You started saying something about emphysema, but can we also talk about the COPD at large? That even if you don't have emphysema, how does it affect people who have asthma? And what is chronic bronchitis?
So basically, yeah, so lung cancer is one of the aspects, but the commonest effect of smoking is its effect on worsening of breathlessness, be it by chronic bronchitis. Chronic bronchitis is nothing but a production of cough which goes on producing sputum. This is
Mm.
because of the irritation of the lining of the airways. So basically, the lining of the airways gets irritated and the sputum production goes on, and there is a narrowing of the airways. This causes a feeling of breathlessness, similar to what an asthma patient feels like. Also, it can worsen the asthma itself. So patients with asthma get worse symptoms when they are smoking because obviously there are so many irritants which are causing various inflammatory effects. Some are having allergic effects. So all these things trigger off asthma attacks as well as they cause a worsening of asthma. Then there is emphysema, where the lung itself starts getting damaged, and it can start getting damaged in the very early stages. So very often I would tell my patients that you are afraid of lung cancer, but the most worst symptoms are those of the COPD patient.
Mm.
Once the age progresses, and even though the person has, and especially when the person has already smoked 15 years, 20 years, the lung damage is already happened. And then eventually in old age, they start getting the severe breathlessness. Also, these patients can get other effects on the vascular system. So they can get it can affect the linings of the blood vessels. So that causes something like burgers where they walk and they start getting pain in the legs. So
Mm.
similarly, it can affect the blood vessels in the heart, the blood vessels in the body. So this also is one of the late complications which come. So these are not so much known. Similarly, the person can have an altered sense of taste. The person can have an altered sense of smell because of the chronic smoke. And the basic effect is the one on the lungs causing breathlessness. They're not able to climb stairs. They're not able to do as much activity as what they were able to. And emphysema is the worst because there is so much of air hunger, so much of breathlessness, and it doesn't even kill. It just makes the prolonged agony. So this is really very painful condition, which when I tell my patients about it, it helps them to quit smoking.
So when we say that so what Dr. Jayalakshmi is trying to tell us here is that when we say asthma, it is the narrowing, or it is the spasm of the major airway system. Bronchitis is that of the secondary and the tertiary branches. And emphysema is the chronic affection of the lung parenchyma itself. There is no gap between the lung airways and the lung substance. When we say pneumonia, it is an acute infection. So it is like in less than 6 weeks. So when somebody starts smoking, in fact, I have seen people who have dropped down with a massive heart attack because probably that one smoke tilted the balance on the other side. There have been cases where people were smoking and they've had acute stroke. So this is more than the lung. But the problem with the lung diseases is that it is chronic and it affects your living. So I think we have to start putting the disclaimer that smoking may kill or may not kill, but it definitely stops you from living. Something like that we need to kind of bring out. So only then because I mean, I have patients or I have friends or we all see people who come and say that abhi tak to kuch nahi hua hai. I mean, nothing has happened so far and I only live once. So what about the effect of those? So there is in the cigarette, there is nicotine, which is what they actually crave. But what about all those additives which I was looking at? I mean, I was shocked to see that there is arsenic also there. And then there are those 100, 200 hydrocarbons in there. Do they also affect the lungs in any way, Dr. Jayalakshmi?
So basic affection of the lungs is not so much from the nicotine as from all these additives. So these are the carcinogenic. So there are some 7,000, you mentioned the few important ones, but there are many, many, many more. It's like the smoke has so many attributes and some 7,000 chemicals. So these just go in, they affect the lining of the lungs, they affect the lung tissue itself, they go into the blood and have carcinogenic effects. So that's why smokers even can get cancer of the bladder, although the bladder is not directly exposing to the smoke, because it goes into the blood and acts like a carcinogen for the bladder. So each of these goes and targets these airway lining cells, and it is a huge barrage. You are attacking the lung with so many fumes and particles and toxins. And what can the poor lung do? It first makes the lining, the cilia, which are supposed to bring out all these toxins, are first affected. Now the cilia are not able to function. Then the lung tries by producing more and more mucus so that it will dilute the effect of the toxins and try to throw it out. Then the lung tries to hyperventilate and try to throw out the toxins. But whatever said and done, when you are taking the toxins by yourself voluntarily, there is very little the lung can do to protect itself. So this causes the lung lining to get inflamed, causing the bronchitis, which we often see, asthma attacks, emphysemas, COPD, bullae formation in the lung. Sometimes the whole lung tissue gets converted into small, small bullae. This we often see in smokers. It can cause interstitial lung disease, something we call as RBILD. So the whole lung interstitium gets thickened, somewhat like how the lung fibrosis patients get. So this is interstitial lung diseases. Typically, it can stop when the smoking is stopped. So this is one of the condition which gets reversed as soon as smoking gets stopped. So it can affect every part of the lung and its lining and the tubes leading up to the lung and the throat and the mucosa.
So this is very important for us to know that interstitial lung disease, that means there is this connective tissue or there is a cementing substance in the lung matter which holds the lung together. This is it is the cement between our bricks foundation. So if smoking is causing interstitial lung disease, the minute you stop smoking, it reverses the interstitial lung disease caused because of smoking reverses and your quality of life will improve. So, Dr. Jalishma, I'll come back to you. I have something very, very important asking you for that. But, Dr. Bhargav, if somebody wants to stop smoking, what are those steps they need to follow?
Right, madam. So if anyone wants to stop smoking, there are three, four things which we would eventually. So first thing, managing the withdrawal, which is a very important thing. So, right, managing the cravings and of course the psychological dependency. These are the three major factors which we see when someone wants to, how am I going to deal with this? Once I stop, I'll go through something like, restlessness, I feel tensed, I feel anxious, and how can I manage my craving? So these are the very common questions. Okay. Now, ideally, the best outcomes which I would suggest the patients, it's not just medicines, it's always the pharmacological treatment with the behavioral therapy support is what I would say the best strategy to approach and to move forward to achieve this abstinence from smoking.
So is it that they have to, they can just go cold turkey, like I'm stopping today and I can stop, or I set a deadline and I stop, or I slowly decrease it?
Right. So most of the times when a person goes cold turkey, right, it's not like we will not advise, but the chances of relapse are a bit more high because once you go for cold turkey and you might sustain for a week or so, and now the third option, which you said, like I'll take 5 cigarettes, then just come to three, come to two, yeah. So what we would suggest is there is something called as fixing up a quit date. Whenever a nicotine dependence, we'll say fix up a quit date. And now it's just like, preparing to fly. So you have to arrange certain things there, yes, prepare a quit date and make sure you have some distractions to manage your cravings. Make sure your doctor and therapist are there in your place and how to deal with this craving. There are a lot of pharmacological interventions. So I think this is a better way to approach rather than going cold turkey, is what I feel.
So, is there a connection between smoking and other mental disorders also, which will probably, not let them, because it's like it is very easy to say you need to have willpower,
Right.
but it's not as easy to do it.
We
So,
also say this actually, just willpower might not be enough for you to stop smoking, right? There are other helps you have to. Seeking help is very important here. When you say this particular part, this is definitely a bi-direction. In fact, sometimes this becomes a loop. I'm anxious, I get into dependence, and dependence causes me more anxiety. So it's this way. See, I can give you two dimensions for this, madam. So one, suppose you see anxieties, depressions, or sometimes we see schizophrenia. You say that's a severe form of mental health. We see smoking is very high in these people. The reason become we spoke about this reward circuit in the bottom. They become little dull or clouded in these psychological states. And now this nicotine might give them a temporary relief, leading to this dependency or addiction. Second important dimension for this is, as I said, coping. I'm very anxious and now I just relieve this psychological stress with this particular thing. And sometimes, you know, that might give them a social identity. That is one more thing where a lot of social stuff happens around this. So as it's a bi-direction, that might cause this, and this might even worsen.
So schizophrenia is one huge spectrum, which is like totally different. But I've seen in a lot of bipolar patients, there are some who, when they're depressed, they want to smoke, and when they're in mania, they want to smoke. With both spectrum, which is more prevalent in mania smoking or in depression smoking?
Both. We really don't have but I think usually if you particularly ask me, mania, when they have more of a hyper state, they feel a lot of energy and total absence of insight might happen in a full-blown mania. Yeah, the prevalence would be little more there when it's not just with nicotine, probably other things like alcohol and other hard drugs might get into the picture. Yeah.
Dr. Jayalakshmi, when you see patients with chronic bronchitis or emphysema, or you know that this is because of a chronic smoking habit which has caused a lung disorder, and you talk to them about stopping smoking, whether their family is present or they are not, what is that reaction which comes out? They are agreeable, they are not agreeable. What stops your patients who have known lung disorders from stopping to smoke?
So many of them come telling that we are smokers, so we are scared that we have had some lung disease. Mainly they're afraid of lung cancer. So they say, I want to screen and we want to quit and we are thinking of quitting. There are some of that group. When there are some who are already having the COPD, and they have already quit. Because the COPD symptoms very often, many times when we ask our patients, did you used to smoke? So they will say, yeah, we used to smoke. But now we have quit since 5 years or 4 years. So we said, what made you quit? Said, no, I started getting symptoms of cough and breathlessness and wheezing. So then I decided to quit. So that does happen often. It's a little less common that actually with symptoms of COPD, they continue to smoke. So these patients are those who are really addicted and they're taking. So they say from 20, I've cut down to 5, I'm cutting down to 3, and they're under heavy pressure from their family to stop smoking. So they say we are doing by ourselves, we are trying, we are reducing. So that is often the approach. It's rarely like I have had colleagues also of mine. They say ki we don't want to smoke. I had one of my friends here admitted here for preoperative assessment. So he said ki no, don't talk to me about stopping smoking. Just say whether I'm fit for surgery or not. So, so then there are such patients also who just don't want to talk about it. So these are the various stages.
So
We
I
tell
think,
people to stop smoking.
yeah. So I think one of the things which Dr. Lakshmi said is very interesting. I think we need to make smoking as one of the mandatory reason for what to say, making a patient unfit for any type of surgery. You finish. If it's an emergency, anyway, you won't smoke. But say for example, we have smoking associated with chronic gallstone, cholecystitis, that is inflammation of the gallbladder, irritable bowel syndrome, and it is a huge gut-brain axis, and the dependency and the problems with smoking only increases. It is also associated not only with lung cancer, but is also associated with colon. It is also associated with bladder, and of course, the cardiac, the heart attacks, and the stroke. It can cause what Dr. Jayalakshmi was talking before, what is called as Raynaud's syndrome, in which the blood vessels in your limbs get shrunken, and it is not the vein, because if it is a vein, it will cause collection of fluid, but it causes arterial ulcer, which are what we call as peripheral vascular diseases, very difficult to treat. It can end up in amputation. So, but Dr. Jayalakshmi, there are two concepts here. One is that even though you may have brought down your smoking of 20 years to 20 years or 20 cigarettes to 5 years, your pack year does not change. So what is this pack year we are talking about?
They smoke 1 pack a day for a year, it is called as 1 pack year. So depending on the number of pack years smoked, the seriousness of the chances of getting cancer or the COPD, this all is proportional to the number of pack years smoked. So even though the patient is going on smoking, even if he's smoking only 5 cigarettes per day, pack years are still continuing to accumulate. So it still worsens the risk of lung disease. So it's not really so helpful to reduce the number of cigarettes to say 3 to 5 per day. The real effect is seen only by really quitting the number of cigarettes, the smoking habit itself.
And once you quit, how much time is the quitting period where we declare them that they are starting to go into the safe zone? So how many years they have to quit when we say that, yes, now you will start going into a no disease zone?
So this differs for the different illnesses, but generally the life expectancy or they become towards normal. They will never become
normal,
completely
but towards normal.
as the normal curve, but towards normal over 5 to 10 years, the
Yes.
curve starts approaching towards the normal.
Yeah. Correct. So it is, we say that anybody who stops smoking, the benefit of stop smoking will only come after 5 years. But that does not mean that your risk of lung diseases or cancer totally disappears. So, ma'am, how does smoking in the family, even if you are a person who doesn't smoke at home, the presence of a smoker's breath in the, or what we call as a secondary smoking or passive smoking, or the presence of nicotine and tobacco in the house mixing with the environment. I read somewhere that it is one of the causes of tertiary syndrome, I mean tertiary smoking, that you don't smoke. But is that true? Does that affect children especially? The
Children are affected by the secondary smoke. There is a higher incidence of asthma in these patients, more incidence of getting lung infection. That is, they get frequent colds or coughs. So this tendency increases in the children when they are exposed to the secondary smoke because it affects their ciliary activity and it affects the immunity of their lining. It does not affect the lungs so much like causing COPD or emphysema or something, but there are incidences where the COPD or emphysema has been traced back to heavy passive smoking as well.
So we have an entity called as reactive airway disease, especially in children. What we cannot avoid is the external pollution, because try to remember, around 20 years back, it was mandatory that all industries need to be at least 20 kilometers away from any metro city. But the way city is growing, the congestion in the city, the car and the vehicle fuel smoke which is coming, one thing which is in our control and we can save our children is to stop smoking, because that is only adding to all of this. There's a very interesting question. I'm just going to take one question before I go to Bhargav. Very, very interesting. My uncle would smoke half a cigarette first, put it out, and then smoke the remaining half later. Is this actually a good way to lower the number of cigarettes per day?
It could help to lower the number of cigarettes because you're doing very little at one time. But generally, it keeps the nicotine effect on and keeps the addiction on. So basically, it doesn't help you to quit smoking as such.
In the long
So,
run, probably.
yeah, yes, Bhargav?
So, yes, madam, I do agree with madam. Actually, yes, in the long run, it might not be effective.
It
So,
will not. So I mean, it is like you are just fooling yourself, or you're just pacifying yourself that, see, I'm not doing that. But eventually, the thing concept is that your pack years are still accumulating over the years. Okay. What about is there this vaping and e-cigarette? Do they affect the lungs similarly?
So in uh, theoretically, the advantage of vaping is that all those chemicals are not there, which are there in the normal cigarette. So those 7,000 come down to much fewer number, but still there are chemicals in the vaping fluid itself which can trigger and irritate the bronchus. It can cause something called as a vaping lung syndrome, which is like an acute ARDS type picture. Acute lung inflammation can be caused by that. Also, it can affect the lining of the airway. It can reduce the immunity of the cilia. It can reduce the functioning of the cilia. So, this all effects are still there even with vaping. And it is also not known as to how much the vaping. It's a less studied thing as to how
Correct.
the vaping fumes really affect the lung. It's not water vapor which is there in the vaping fluid. It
Correct.
is chemicals.
Correct.
Basically, soluble NOCs are there. Basically, the organic compounds are there which can trigger the lung and which can stimulate a lung acute inflammatory response in the lung. Hence, vaping is generally considered dangerous. Plus, also it adds to the nicotine addiction and can trigger an cigarette cigarette addiction later on.
Okay.
So,
Yeah. So, Dr. Bhargav, what are the common myths around quitting smoking? I mean, we hear so many. I should not. I. I'm not going to give you any suggestion, but maybe, I mean, people come to us saying that I smoke because I have constipation. Then, if they don't smoke, yeah.
Yeah, man. The most common things which I hear from my clients is, "What's the big deal, doctor? I have been smoking for years, and why to stop now? I know that's not gonna. Anyways, the damage has happened.
Mm,
And I cannot stop it. This is one important thing, right? And second most common thing is, yes, doctor, we did try multiple times.
mm,
We lost the battle. So I just gave. These are the
mm,
two extreme people, like, which we face. So, but the facts here we should understand, madam. You can stop smoking at any age. I think madam was saying, even if you stop it at 60, years add to your life, fundamentally. And the second important thing, relapse, where we see a lot of the smoking, than any other addiction, smoking relapse is the most common, like, so it's the problem here is relapse is that comes as a part of recovery curve. You will go through this. So many a times when you see any long term, a smoker who has been abstinent for the long time, there the relapses would have happened multiple times, actually. So in fact, we say relapse is a rule.
mm,
So I don't think so. And every time, what I tell my clients is, relapse is a kind of a feedback. It's an info for you. It's a feedback for you. Like, what happened and how did you get into this? So next time you can use this feedback or the information to just deal the next relapse in case. So it's a way you accumulate the knowledge and get more aware of your smoking habits. So not to worry about. So these are the two major things.
What are those um, pharmaceutical interventions to stop smoking?
Right. Coming to the pharmaceutical interventions, initially we start with nicotine replacement therapies, right?
Mm,
So it might be in the form of chewing gums and transdermal patches,
yes.
but yeah, madam was speaking about e-cigarettes, no, but it is not considered as a first line treatment for a nicotine replacement.
Mm,
And what madam said is, we call it as gateway effect.
mm,
Youngsters, most of youngsters comes to us, doctor, no, I don't want to smoke, just I'll vape. I said that opens the gate. You'll land up
mm,
where else, where
mm,
right?
mm, mm,
So, nicotine replacement therapy. So, we might ask them to use some patches or gums, and if that is successful, I think most of the times we'll end. Otherwise, I personally feel I would say, like, to manage the cravings, like, there are certain groups of drugs. Most two commonly we use in India is varenicline and bupropion, what we
bupropion.
so they
Mm,
reduce the craving. They stop this dopaminergic reward system. So that a neuro adaptation might be little and these are the most common ways. And as I said, the third one is definitely addition of a therapy. Especially when it comes to therapies, there is a lot of confusion what to start, what to do. So, see, we all speak about CBT, but one thing I would say is, if you have to see two things, if the patient is motivated enough to do CBT. No, if you start CBT, if there is no motivation to get into it, no, the CBT might not work. So initially, what I suggest my psychologist is to start something called as motivation interview. That is what
mm.
we so, to make them aware and to just make them more. Then on maintenance, you can shift them to CBT. So all these combinations are we can speak about in terms of medical management.
What about, I mean, generally when we talk about the pharmaceutical interventions, people immediately will ask us what are the side effects. So, what are the side effects of bupropion and the other one?
We ideally, one major side effect of Bipro, we will avoid it in seizure patients.
These are patients.
It is otherwise regular side effects like gastritis, and
That's
the
right.
same would happen with varenicline as well, but nothing or like
Exactly.
different.
Yes. So, do they have to take it like a lifelong thing, or it is like a course?
Course. We usually try it for a period of. Again, there is nothing like a protocol for this. See,
Mm,
sometimes what we see is for a period of 6 months. Sometimes we might give these things for them, right? Yes.
Do we do it in incrementing dose
Yes,
increase? The
madam.
valcycline is something which we
Which will
increase with
start with 1
dose.
mg and then we can increase it. That depends on the patients because I'm not suggesting any protocols because here is every patient is different. Every
Different.
patient's social structure
Correct.
is different. So we don't have to, we have to sometimes tailor the doses for them, right?
So there is one more myth that when you stop smoking,
Mm.
the other cravings increase and you actually put on weight and you eat a lot, you know.
As you said, that's a myth, madam. So I don't see any biological happenings behind this. Right? Probably to cope up the mild withdrawal they get into, like that irritability, or sometimes they might try to cope up with this kind of unhealthy lifestyle. But I don't think so. This would cause that.
Yeah, Dr. Jayalakshmi, there is one question that says, do the bad effects of smoking completely go away if one stops smoking? How long does it take? We have already answered that, saying 5 to 10 years. Does the cancer and heart risk stay even after quitting smoking for 3 years?
There would still be a risk of cancer and heart risk even after quitting, but it slowly starts coming down to the normal level, the normal risk that any normal person will face. So it takes a period of time, as we discussed earlier. It takes about 5 to 10 years, and slowly the curve comes and starts approaching the person who has never smoked.
Somebody is very curious to know what is the temperature of burning end of cigarettes. Definitely more than 100 degrees centigrade.
Yeah.
Because when we use cigarette butts, and there are so many movies and so many literature which shows that it burns the skin, literally leaves a scar, and it is very, very painful. And not only that, the cigarette burns, the chemicals in the cigarette burns also injure your skin. So chronic skin injury with cigarette, even using it in your hand, is also one of the causes of local skin cancers, a chronic injury. Because of that, people do develop warts and they do develop break in skin. And there are cases reported where we have seen skin cancer in smokers also. So I hope that answers your question. Is pan supari or oral tobacco uh, does it affect the lung or it is more gastrointestinal? What about the mental health?
It is more gastrointestinal and affecting mostly the throat, the mouth, and causing severe types of cancer of the oral lining and the throat, and also the stomach, but not so much affecting the lung in terms of COPD or emphysema, although it increases the lung infections by reducing the ciliary
Immune,
function and the immune.
yes.
And
But
also the other cigarette ways like chula are all
yes,
equally harmful,
yeah,
even though it's passing through some vapor or something. In fact, the quantity of the smoke is much more over there. And the quantity of the cigarette, the nicotine which goes in is much more. So it has more of addictive potential and it is equally harmful.
correct. So that means the smoke pot or the hookah or the reverse smoking, all of them are equally destructive or equally affect the lungs. But chewing tobacco, the cardiac and the cerebrovascular accident risk remains the same. Whether it affects your lung or not, nicotine definitely affects your heart and your brain also. Um, but supari is different. That is betel nut. But betel nut also causes oral cancer, maybe in the long run. And if it is associated with nicotine and all those fancy preservative, the oral cancers definitely increases. After quitting smoking, what precautions should one take to undo the damage done already? Is there a way to assess this damage? Dr. Jayalakshmi.
So we do commonly, we see the lung function test. This is a very good way of assessing the lung functions, how much damage has already been done. And this common is the pulmonary function test. We can do the diffusion capacity, which actually measures the capacity of the lung to take in oxygen and give out the carbon dioxide. So that can be checked. And also we can do something called as a 6-minute walk test, which can also assess as to how much patient is able to walk within 6 minutes, how much the oxygen saturation remains good while they are walking. Also, we can do various tests like the oscillometry test, which see the lung function. So these are all the lung function, and we can see it annually or 6 monthly and see whether it is recovering after stopping of the cigarette smoking. The other thing we can do is the chest X-ray, a basic test, or even we can go for a CT scan, where we can go for a low dose CT scan or a proper high resolution CT scan, which can also show us how much of emphysema particularly has happened in the lung because of the smoking habit.
Yeah. So let me also clarify here. Low dose CT is definitely advocated as one of the easiest to do scan. And when we say low dose CT, it means the radiation is very, very low. And it is something which you need to do probably once in 3 years, not even annually. But if your risk for lung cancer, that means there is a family history of lung cancer, then it is better to do it annually, because the earlier we pick it up, it is better. So this is about the low dose CT, lung CT, that low dose CT scan for the chest, for the lungs. But if you want to know what Dr. Jayalakshmi is talking about as in COPD, emphysema, and interstitial lung disease, it is important to do the high resolution CT scan, because we cannot see the interstitium in the low dose CT. We need to see everything inside. And again, high risk people, you only need to do it once in 3 years. Clinically, also, we evaluate you and tell you how your lung is performing. If your goals, or if your health goals, if your cholesterol, your diabetes, and your general physical activity is improving, that itself is a very, very good indicator of improving in your immunity and your lung status. Am I right, Dr. Jayalakshmi? Because we do not want to scare people in saying that do CT scan frequently, because there's a lot of radiation exposure there also. Ma'am, what is your take on that?
Yes, definitely. But we should have the, as you said, whether you're able to walk, how much are you able to walk, whether you're able to walk for half an hour, whether you're able to run, whether you're able to climb stairs, 2 flights of stairs, 3 flights of stairs. This also gives an indication of your lung capacity. So these are the, depending on your symptoms, you will come to know whether you are getting breathless on routine activities or not, whether you're able to do your daily activities. And a lung function test is a very effective tool for picking up the lung functions.
Correct. So lung function test is what we call as spirometry. It is a little tricky test to do, in which you have to blow, and we have a set of parameters which are measured, which are your lung volume, your breathing capacity, your forced expiratory volume. There are a lot of those things, and it's very simple to do. Only thing is you need to understand how to do it, and there are trained technicians who help you to do that. Yeah. There is a question here, Bhargav. Is chewing gum helpful in quitting smoking? Regular chewing gum.
I don't think so. Regular chewing gum might not really, but when I think the viewer is probably mentioning this nicotine chewing gums is what I think, madam. But regular chewing gum, I don't see any way it helps a person. But yeah, when this, I think the chewing gums, nicotine chewing gums, yeah, they come under this nicotine replacement therapy, and they have a fixed nicotine doses. That is, it do have nicotine, 2 mg or 4 mg we prescribe. Yeah. Initially, what we do is that would definitely reduce the withdrawal when you stop smoking and take these gums. So ideally, if someone is, we usually prescribe it for 12-week period, like around say 2 to 3 months. So depending on number of cigarettes, it might range from 8 to 12 gums per day. Then we ask every week or somewhere, just gradually reduce it, so that by the end of 12 weeks, you can totally come out of this particular thing. So yeah, in that way, these gums would definitely help sometimes.
So to add on this, you have to remember something. Each of these gum will be either there will be sugar in it, or there are some sugar-free variant. The sugar-free variant does not have a natural sweetener. It has an artificial sweetener like sucralose or lactulose, or not stevia. So that itself in the long run can cause a lot of harm. But because the concentration of these gums, because once you want to have a gum, it is not that one gum which replaces one cigarette. It is 4-5 gums which replaces that one cigarette. So you're trading one addiction for another addiction. There are certain gums and these lozenges which have menthol in it. And menthol also in the long run can cause a lot of mucosal injury, and it can also cause vitamin B12 deficiency. So this is something which are very less known. So everything in excess or does not, if it is not maintained in the right capacity which it should be used, can cause harm. But cigarette, even one cigarette can cause, definitely can cause harm. So it is always no to cigarette. What about these other substances which are comes along with? I mean, we have seen people literally open the cigarette, add something, and then roll it, whether it is weed or it is those chemicals and all. Do they affect lung or do they affect our psyche? What is more danger here?
Both. It's
Yes,
undebatably both. Yeah. Yeah. Say the you see the cannabis is mostly used in that way.
cannabis is healthy.
Cannabis,
Yeah.
sometimes opium for that matter, right? So
Mm.
they roll up in this cigars and they do. It's equally, in fact, more dangerous than what it is, right? Yes. Yeah.
In fact, yes. It's an open form and it is known to cause pulmonary embolism. It is known to
Right.
cause infective endocarditis. I mean, it can affect your heart and lung directly because it's like just a open source of drug and nicotine together. Is e-cigarette as harmful as health for health as regular smoking? Dr. Bhargav has already answered it. Madam has also, but do you want to add something more here, Bhargav?
It's
E-cigarette and vaping.
no, absolutely no. So, from a medical perspective, that is not at all considered as a first line replacement for any of these things. It would not work in the long run. And, as Madam was also telling, that doesn't have that also, if I'm sure it has aerosolized nicotine with
Mm,
some acetaldehyde or formaldehyde,
yes,
something
yes,
like that.
yes,
So,
yes.
definitely, which is more harmful. Like,
Correct.
you're ultimately trying to create a problems, trying to solve one more. So it's just like you want, yeah. So I don't think so. That's
That's
definitely
it.
a right strategy.
So
Yeah.
there is interestingly something. There is one set of people who say, you know what, I really don't smoke. I do take the puff, but I ensure that it does not go into my lung and I breathe it out. Ma'am, I mean, so we it please your comment on that.
I don't believe it.
No, there are.
It goes, it will go into the lung. Even
It
if
will go
it's
in.
not actively inhaled, it is part of that airspace there. So
Correct.
part of it will end up going into the lung. If not full deep into the lung, it will affect the bronchi, the terminal bronchioles. It
And
will be not possible to keep it inside the mouth and not be able to inhale or exhale it out completely.
completely.
Yeah.
Yeah, Bhargav?
Yes, madam, please. You want to ask some question?
No, no, that is odd. So, does it also affect, I mean, the smoking in the mouth
Yeah.
smoking is what it is called as, if I'm not wrong.
You
Eh,
see, as madam was, once it enters into your system, I think yes, it percolates to right.
Whichever way.
Yeah.
Yeah. So smoke crosses not only your lung, it crosses your mucosal barrier. It also crosses your blood-brain barrier. So that is why it is a lot of emotional rush, a lot of neurotransmitter changes which happens. Somebody has asked something very, very different, but I'm going to spell it out here. Does smoking cause skin aging? Smoking causes aging at a cell level, at your cellular, like if your one millimeter of your skin has million cell, it will cause aging at your cellular level. But does smoking cause skin changes? Definitely. We have seen people with very coarse skin. If somebody, so there are people again who say that when I smoke one cigarette, I drink 2 glasses of water for hydration. Does that help?
It wouldn't help. Basically, smoking, it acts as an oxidant. So it acts as a reverse of the antioxidant. So
Very
that
good.
is how it actually affects the lung linings as well. And that is how it causes emphysema. It
Correct.
acts as an oxidant and it destroys the cells at that level. So it causes aging, it will cause affection of, like ma'am said, all the cells in the body. And drinking water would not really help to reduce
Help
the
anyway.
effects.
No drinking along with the smoking helps anyway. So nothing helps the smoking anyways. Yeah. How can we alter a cigarette with a nicotine chewing gums? Dr. Bhargav did explain about the chewing gums at detail that there are 2 mg, 4 mg, 8 mg, and 16 mg. The patches are 7, 14, and 21. And these are used. But believe me, the patches, in fact, have got more dramatic side effects compared to cigarette smoking. Well, it's very concentrated nicotine over there. Am I right, Bhargav, in that?
Absolutely right, man. And most common side effect we see with the patches is a lot of sleep issues and night
Yes.
terrors, and that in fact few clients would worsen the use of the smoking habit much becomes much more because they don't sleep in the morning, they get restless tomorrow, and they just get into the smoking habit. And so I think it should be used with caution and yes, with all the side effects in them.
Okay, we have last 5 minutes. I'm going to ask you one more question before we close. This is again a set of people who say that we smoke only when we drink and we drink occasionally.
Uh, they go hand in hand most of the times, right? Neurobiological conditioning or social context most of the times,
Yes.
that is what more than neurobiology, I think it's social context, which makes that those two things a big nice pair. So ultimately, both of them, when they all act on the same mesolimbic, the reward pathway, which
Mm,
probably would have an enhanced effect. Yes,
mm.
for a temporary period of time, and and some clients do say subjectively, and one more combination I would say is coffee with smoke,
Oh, yes.
because right.
Chai with smoking and
Child
coffee with smoking.
smoking.
And yes, a
They say
break.
that enhances this my subjective buzz. Okay, right. I feel better with this, right? So and I think whatever said, and this is definitely more deadly combination than smoking alone. Yeah. So yes, definitely not advisable.
Correct. And also to answer this question, remember something. Whichever form of nicotine you're using, whether it is sporadic, it is definitely leaving you open for addiction. What is going to tell that you are not going to be crossing that margin or that boundary and going to the other side when a stress comes and you don't know how to handle it? So, this occasional smoking and alcohol can become a lifetime affair by the time you realize it is not in your control. And in today's time, in Indian scenario, younger and younger people are becoming diabetic hypertensive. We have something called as obstructive sleep apnea, daytime narcolepsy. That means you sleep when you are driving, you fall asleep on the wheel. Smoking adds to all these issues. So smoking is never ever good. Not even one cigarette is ever good. So can I have the closing sentence, but like advice from each of you, ma'am?
So, my advice is for all the smokers out there, it is causing a lot of disease, harmful for your health. So quit smoking and try to replace it with more healthy activities, like have exercises, have evenings with friends or something planned out for the whole week or months when you're initially going to quit smoking, so that the whole journey becomes easier for you. And like Dr. Bhargav said, even if a relapse, it's part of the journey, and just try again.
Dr. Bhargav?
Two major things for the viewers. One, definitely, if you have this habit of smoking, if you really are motivated to stop this, identify the triggers and break the triggers. Probably the triggers or the situation, it might be a situation, person, whatever it is, will have a beautiful, I would say, the relapse risk reduces. And second important thing I want to tell is there is a small technique which we tell the clients, like it's delay, distract, destroy. So 5 minutes technique, when you feel to smoke or you're motivated, no, I should not smoke, but still the cravings are on. So just delay it for 5 minutes, distract yourself for those 5 minutes, and that might lead to destruction of the thought to smoke. So this is very important.
Excellent. So I will close with this saying that I think we need to change the way we think about smoking. And our cigarette packs should come with the warning saying it may not kill, but it stops you from living. With that, I close this webinar. Thank you so much for being with us, Dr. Jayalakshmi and Dr. Bhargav. I hope you enjoyed this session as much as I enjoyed conducting it. And please do join us again for our monthly Talk Pro Health. We will keep sending it to you. And dear viewers, whenever there is a problem, do not hesitate to take help. Help is only an arm away from you. And those who take help, help themselves. It is not about your family or it is not about your children. It is about yourself. You are going to do yourself the best benefit by taking care of your health. So please be pro health. Thank you very much.
Thank you.
Thank you.
Dr. Bhatt.